What should I do if I experience heavy implantation bleeding while pregnant?
Hello, and welcome to this important discussion on pregnancy health. Today, we'll be discussing a concern that some pregnant women may encounter: heavy implantation bleeding. We'll cover what this is, why it might happen, and most importantly, what you should do if you experience it.
What is implantation bleeding?
Implantation bleeding is a phenomenon that may occur in the early stages of pregnancy. This happens when the fertilized egg attaches to the lining of the uterus, causing a small amount of blood to be shed. It's generally light and short-lived, often mistaken for a light period. However, heavy implantation bleeding is not as common, and it could potentially indicate a problem. This could be heavier bleeding or bleeding that lasts longer than what is typically associated with implantation.
What causes heavy implantation bleeding?
There are several reasons why implantation bleeding might be heavy. It could be due to variations in a woman's menstrual cycle or hormonal fluctuations. In some cases, it could also be a sign of a more serious issue, such as an ectopic pregnancy or miscarriage. It's important to remember that every woman's body is unique, and what's normal for one may not be normal for another.
What should I do if I experience heavy implantation bleeding?
If you experience heavy implantation bleeding, here are the steps you should follow. 1. Don't panic. While it's understandable to be concerned, it's important not to panic. Stress can have adverse effects on your body, particularly during pregnancy. 2. Monitor your symptoms. Keep track of the amount of bleeding and any accompanying symptoms like pain, dizziness, or fever. 3. Contact your healthcare provider. This is crucial. You should get in touch with your healthcare provider as soon as you notice heavy bleeding. They will be able to evaluate your symptoms and potentially schedule an appointment for a checkup. 4. Follow medical advice. Depending on your situation, your healthcare provider may recommend rest, specific treatments, or even immediate medical attention. Be sure to follow their advice closely. Dealing with heavy implantation bleeding can be stressful, but remember, your healthcare provider is there to support you. Stay calm, monitor your symptoms, and seek medical attention when needed. Always prioritize your health and the health of your baby. We hope this video has been helpful in understanding and managing this aspect of pregnancy. Stay healthy and safe.